Hey guys, it's Dr. Emer, and you know what time it is? Filler Friday, and we're doing male facial sculpting today, one of my signature feature enhancement treatments. And I'm really excited because we have a good looking younger guy who just wants to have a little bit more masculinization, some structure to his face, and we're going to use some fillers to give him some contouring. So take a look at his face. He already has a sort of defined sort of chin and jawline, but he wants a little bit more. He does have a good substantial amount of volume in the mid part of his face, but he doesn't have contour to the upper part of the cheek. Now, if we were to give him that structure, we could use an implant and we could horizontally place that implant and customize it, but instead, we're going to use filler today. And then long term, we would do other things like temple, under eye, lip. Those are the things you sort of use to sort of finesse with the filler, but today I want to give him that structure. So I'm going to start with his chin. Give me a sec. I'm going to come on over, and because I want to start with the chin because I want to see width. I'm using Restylane Define. It really shouldn't be too painful for him. Define's a really amazing product in this area because it has the ability to lift, but it also moves with you really easily. So we're going to go right on bone. We're going to do small aliquots right along the bone. So watch him carefully. Nice and slow, and PJ, you can tell me if they're saying anything there.
Everyone's joining, just saying hi.
Hey, the good thing about this, you guys, is we can watch this rise immediately, and the other good thing is when you support this lower cutaneous lip area, it actually gives support to the mouth corners, so it can kind of lift it up a little bit. Long term, we could even do neck lipo or internal heating here, and look at, you could see where that bone structure is. Okay, so I widened one side, and now we're going to move on to the other. I'm going to let Social go take a look. You can show them what the chin looks like there. I'm going to come and kind of blend as we go across, so one side done, one side not. Typically each area, because I get asked this a lot, how much filler is needed to really give the look that you want. It's usually about a syringe to 2 per section, unless you're very, very, very low on volume. Guys that have a little bit thicker of skin or have more sagging, they might need a little more filler placement. I'm going a little wider with him too, because I really want, there we go, to get a little more width, because when we build out his masseter area, it's going to structure his face more square.
And for this product you're using, what is the length of time they can expect to have improvement?
So yeah, look at that already. It looks really good. Go ahead and pan. Turn to the side a little more, show them something. So his nose is really straight and has a nice angle. When you draw a line going all the way down, now look at that. The line fits perfectly. What's missing is some lip volume to balance that, but overall, now we have the right proportion if we drew a line like this. Take a look at that. So this product will last him about 9 to 12 months, and we're really soft. This filler almost never lumps or bumps. So let's bring him back. So now we have a nice square appearance. I just want to build out a little horizontally here to give him some structure. So we're going to go right onto the bone, and in this case, I want you guys to see we're not going to go lateral. Going horizontal. We really want to give him a little more of a squared off look. Good. Okay, so just a highlight there. I'm going to switch to the other side. Perfect. So if you take a look here, in women we can draw an angle that's a little more acute, bringing it down. In men we're going to come a little bit more horizontal and build it across towards the lip. And pinch.
Do you want to know what age should you start eating filler?
Well, there's no real age on when you should start, although I will say I have had patients in their teens come to me with their parents who either work in TV or want to have a bigger lip or a specific under eye that they see shadowed and light when they're on TV. So I have been subject to do a little bit younger clients, but filler is not really an age thing. It's about shaping and contouring. Remember, we're creating a structure here. We're not necessarily just filling a line for him. So I think he's a perfect age. Middle age is great. But you know, my sister in her 20s, I mean, all she would talk to me about was cheekbones. You know, that's what she wanted, was cheekbones. So you never know age, really, when it comes to the filler. So let me take a look. Overall, nice, more structuring here. Just gonna do a little bit higher. So remember, I always talk about superior medial injection to give him that more squared off look. Now I'm gonna lay him back a little bit. Turn to the left now. Perfect. And we're gonna start on the jawline. So go ahead and bite down a second. Just wanna see where the bottom part of his jaw is. See, his angle is about a little low right there. So we're gonna work on building the angle a little bit. Now with HA fillers, you guys, you know, you usually see me injecting radius. You don't see it as much right away, but what we're gonna do, if we focus on the angle of the mandible primarily and kind of cluster it here at this 90°, you'll be able to see it more, especially when he bites down. So go ahead and bite down a second. See, it's starting to come out now.
Do you want to know if it's painful?
He's a muscular guy. He's pretty strong. What do you think?
No, this isn't bad at all.
He's doing great.
Someone asked if you think that filler prematurely ages people.
Well, here's what I think. If you inject filler improperly, it can definitely cause sagging or irregular look. We know a lot of celebrities, you guys, that don't look good with their filler, and it makes them look older. Some people, you want to place filler to look older, like we're creating a structure for a specific person. So it's not necessarily about age, but you definitely want to make sure that you do it customized to your face. Perfect. All right, look straight for a second. Bite down again. There we go. So now you guys can see the angle right here much more defined. Now we're going to come to this 90° angle again too. And try and build that out slightly. He's doing great. Now remember, we're using a reversible filler right now so that he has more trust in the process, and if there's any look he doesn't like, that was great. If there's any look that he doesn't like, he can reverse it. But if he wanted something more substantial, we would do radius, or even Bellafill long term for more permanent filler.
Which HA do you like for the chin?
I liked a lot of HAs for the chin. Today we did Define. I love the Luma. Ultra Plus. Hold on. Look at that. Wait for a sec. Bite down again. Good. I want to try and create a little bit more of an angle here for him. The Luma, Ultra Plus, Restylane Lift, Restylane Define all work really good for this area. And again, continuously trying to define more of this 90° angle at the mandible so that he gets a little bit more definition there. Okay, so now we're going to do an Emer reveal. We're going to give him the phone. I'm going to wipe him off the best I can, kind of clean it. We're going to give him the phone on Instagram so he can take a look and take a look at his face. It's good to stay in that position. That position's perfect because then you can see the angles. Take the phone real quick, grab it, hold it up, take a look at yourself,
Wow.
and tell me what you think.
Yeah, it's incredible.
So, lift it through here, but not feminized. I want you to look at this angle. The chin is brought forward, and then you have more definition now here, so you have more of an angle. Bite down a second, so you can kind of see, even if you bring that in a little, take a look. See that pop out a little bit?
Mm-hmm.
And then look at the width now that we created in the chin. So by doing that, it makes this look slimmer, because this is wider, this is wider, this is higher. Kind of pan a little bit to yourself and take a look and see what you think. It's hard to tell always on the Instagram, but I like showing you that. What were you looking to achieve?
Yeah, definitely more masculine. Oh, look. More,
Yeah, I mean, it's great.
Chiseled look, yeah.
So what we'll do is let's switch. We're gonna give that back to our film, and now look in the mirror because it looks different. What do you think?
Wow, a lot different, yeah. I think it
So-
looks great.
Yeah, more structured, more lifted, and remember he already had volume here, so we didn't want to place that because when he smiles, I just want the light to hit a certain way. More definition here and projection here that lifts everything out, and then long term we can tweak other areas. But overall, that's the main things that men tend to ask for: jawline, chin, cheek, structural lifting. We call that male facial sculpting. So now I'll do a quick pan. You just lay back again. Let him do a quick pan, and then we're done. And we have another successful Filler Friday. Great. Let's see what I'm doing before. You're fine, you're fine. That looks really good. Perfect. Yeah, looks great.